Some say the cure for deadly diseases already exists, locked away, hidden in secret vaults, far from the eyes of the world. Others whisper that those who get too close don't live to tell the story. Tonight, we're entering the shadows of one of the most powerful industries on the planet, Big Pharma, an empire worth trillions, shaping medicine, politics, and even the future of life itself. What does it truly hide? And what is nothing more than conspiracy theory? Stay until the end, because the line between fact and fiction here is razor thin, and the truth, or the illusion of truth, might change the way you see medicine forever. To believers in conspiracy, Big Pharma isn't an industry, it's a shadow government. They see it as a billion-dollar giant pulling strings across hospitals, research labs, universities, and politics. The rule is simple: profit comes first, always. Natural cures, suppressed, cheap remedies, buried. Why? Because a patient who is cured is a customer lost. But a patient who needs treatment for life becomes an endless revenue stream. Conspiracists often share stories of miracle plants, strange compounds, even secret therapies, all allegedly shut down before reaching the public. An online voice once wrote, "The cure is the enemy of the business." And this phrase has echoed for years in forums, documentaries, and late-night discussions. But does this chilling motto reflect reality, or is it just a narrative fueled by distrust and anger? Let's talk about numbers. In the United States, insulin, a medicine discovered a century ago, can cost over $100 for a single vial. Meanwhile, just across the border in Canada, a similar dose costs a fraction, around $10. The same life-saving drug, but a system that decides value based not on humanity, but on profit. To conspiracy theorists, this is the ultimate proof. Why cure diabetes when you can make billions selling insulin every single year? But economists and researchers give another side. Drug development is brutally expensive. On average, creating a single new medicine costs billions, and most projects fail before reaching patients. Companies argue that without high prices, innovation would collapse. So is the system rigged to milk the sick, or is it simply the unavoidable cost of science? The debate rages on, with no easy answers. Now let's step into the darkest part of the story: the doctors and healers who never lived to share their discoveries. Coincidences or cover-ups? Case 1, Dr. Jeff Bradstreet. In 2015, Dr. Jeff Bradstreet was found dead, a gunshot wound to his chest. Bradstreet had been studying a controversial compound called GCMF, believed by some to be a miracle treatment for cancer and autism. Authorities called it suicide, but online the whispers spread. He was silenced. His research had just been raided by the FDA. He was challenging mainstream medicine. To some, it was despair. To others, a message. Which is it? We may never know. Case 2, the wave of holistic doctor deaths. Between 2015 and 2016, a chilling pattern emerged. At least 8 holistic doctors across the U.S. died in unusual, often violent circumstances. Heart attacks, sudden illnesses, unsolved shootings. One coincidence? Maybe. 8 in a few months? Conspiracy theorists shouted, they're being eliminated. Each of these doctors had been promoting natural therapies, alternative cures, or experimental approaches. Police investigations, however, pointed to unrelated crimes, tragic coincidences, or natural causes. Still, the pattern was enough to fuel online movements, documentaries, and endless speculation. Are we looking at a string of tragedies or a coordinated purge? Case 3, Dr. Sebi. Then there was Dr. Sebi, the Honduran herbalist who claimed to cure AIDS, cancer, and more through diet and natural herbs. In 2016, he was arrested for money laundering. Weeks later, he died in prison from pneumonia. To his followers, it was crystal clear. Big Pharma silenced him before his message grew too powerful. To authorities, it was a natural death in custody. And yet, the legend lives on. Celebrities, musicians, and activists still invoke his name, keeping the idea alive that maybe, just maybe, he held secrets the world wasn't ready to hear. 3 stories, 3 deaths, 3 official explanations, and 3 conspiracies that refuse to die. Coincidence or evidence of something much darker?
So where does science stand in all this?
To this day, there is no credible evidence that cures for cancer, HIV, or other major diseases have been discovered and deliberately hidden. What we do know is that corruption and fraud are real. Take Purdue Pharma, the company behind OxyContin. They marketed opioids as safe, knowing the risks of addiction. The result? The opioid crisis, millions addicted, hundreds of thousands dead. Other companies have been fined billions for hiding negative trial results, for manipulating data, for inflating drug prices far beyond reason. These scandals are fact-proven in courtrooms and headlines. But miracle cures, suppressed in secret vaults, that remains in the realm of speculation. Science says no evidence. Conspiracy says open your eyes, and you are left in the middle. We are not here to give you answers. We are here to give you the facts and the claims, the stories that fuel conspiracy, and the science that challenges it. What's true? What's fear? What's deception? That decision is you. Check the articles, the government reports, the scientific journals. Don't take our word for it. And tell us in the comments, do you believe Big Pharma hides cures? Or are these deaths and scandals just tragic coincidences? Subscribe for more investigations like this, because the deeper we dig, the more we find that the truth never stays buried for long.